Getting a serious diagnosis like acute myeloid leukemia, or AML, can be incredibly overwhelming. So today, we're going to pull back the curtain and demystify it. We're going to follow the entire patient journey, right from the very first symptoms all the way through treatment, breaking down the essential information you really need to know.
So here's our roadmap. We'll start by making sure we're all on the same page about what blood cancer actually is. Then, we'll zoom in on AML itself. What are the symptoms, how do doctors diagnose it, and what does the main treatment look like? And we'll wrap up with a really important message of hope.
All right, first things first, let's clear up a common point of confusion. What exactly is blood cancer, and how is it different from other conditions you might have heard of?
This is a really fundamental distinction. Think of it this way. An autoimmune disease is like your body's security system getting its wires crossed and attacking your own healthy cells. But blood cancer? That's a production problem. It's like the factory. Your bone marrow starts making abnormal cells that just multiply out of control. And knowing this difference is absolutely crucial because it changes everything about diagnosis and treatment.
Okay, so with that difference in mind, let's focus our lens on a common type of blood cancer in adults, acute myeloid leukemia. And a really important part of understanding it is right there in the name, that first word, acute. What does that actually mean?
So it's really important to get what acute means in this context. It's not about how severe it is, like we might use the word day-to-day. In medicine, acute is all about speed. It means the abnormal cells are multiplying and taking over the bone marrow fast. And that rapid pace is exactly why getting a diagnosis and starting treatment quickly is so vital.
Given how fast AML moves, the body definitely sends out warning signs. The symptoms a person feels are a direct result of those abnormal cells crowding out the bone marrow, basically stopping it from doing its main job, making all the healthy blood cells we need.
You can see the direct cause and effect here. When you don't have enough healthy red blood cells, you get that deep fatigue. Not enough platelets for clotting? That's where the bleeding and bruising comes from. And a shortage of white blood cells? Well, that leaves your body's defenses down, making you vulnerable to infections. Every single one of these symptoms points right back to that root problem in the bone marrow.
So a patient shows up at the doctor's office with some of these symptoms. How do you get from just feeling sick to a concrete answer? Well, the diagnostic process is actually a very logical funnel.
It all starts with a simple, full blood count test. And what's really significant with AML is that often the leukemia cells themselves can actually be seen right there in that first test. That finding is the critical trigger that leads to the next step, a bone marrow biopsy. And that biopsy is what gives the final, definitive confirmation of the diagnosis.
Once that diagnosis is confirmed, the conversation shifts right away to the game plan. For most adults with AML, the primary goal is a cure, and the main path to get there is something called a stem cell transplant.
Let's be really clear about what this is. This isn't just about getting rid of the bad cells. It is a complete system reboot. The whole point of the procedure is to replace the patient's entire blood cell factory and their immune system with a brand new, healthy one that works the way it's supposed to. It's a foundational approach, rebuilding from the ground up.
Now, a big question is, where do these new stem cells come from? Well, there are two main routes. An autologous transplant uses the patient's own healthy stem cells that were collected and saved earlier. But for AML, the more common road is an allogeneic transplant, which uses healthy cells from a donor. And that donor could be a relative or even a perfectly matched stranger from a registry.
Going through a transplant is, well, it's an intense process. After the patient's old system is cleared out to make room for the new one, their immune system is basically at zero. It's an incredibly vulnerable time. That's why patients have to stay in these specialized protected hospital rooms, getting really careful medical care while those new stem cells settle in and start to grow.
So, we've walked through the confusion, the symptoms, the diagnosis, and the pretty complex treatment. It is a lot to take in. So what is the single most important thing to hold on to through all of this?
This is the key message from the expert, and it really boils down to two huge things. First, an accurate diagnosis is your most powerful tool. It's the key that unlocks all the best treatment options. And second, there is real, tangible reason for hope. Modern medicine offers so many effective ways to fight this disease. The journey starts with a diagnosis, sure, but it leads toward the very real potential for a cure.